Well, it could be a game changer in the fight against COVID-19. The World Health Organization saying yesterday that asymptomatic spread of COVID-19 is very rare.
But a local infectious disease doctor that we spoke with today says that everyone needs to take that information with a grain of salt. Annie Satowski joining us live to break down what this means for you. Annie?
Yeah, guys, take it with a grain of salt. That is what he is saying today. It seems like we've been talking about it for a couple months now. Even if you're not showing symptoms, you could still pass COVID-19 on to others. So the WHO kind of walking back a few of those statements, that things are a little bit murky. They said that perhaps saying that transmitting that, even if you're asymptomatic, saying that that's very rare, that might be oversimplifying things a little bit. The doctor I spoke with today says that that data does make some very valid points. However, that is no reason to let your guard down right now.
We have a number of reports from countries who are doing very detailed contact tracing. They're following asymptomatic cases, they're following contacts, and they're not finding secondary transmission onward. It's very rare.
A big announcement from the World Health Organization Monday. Local experts say the findings make sense.
Asymptomatic spread is not the thing that is driving this pandemic.
Dr. Andrew Jameson, the division chief of infectious disease with Mercy Health, says while COVID-19 cases where people don't have symptoms do exist, the likelihood of them passing the virus on to others is much smaller.
I still feel like the majority of transmissions in our country are from symptomatic people. And if you think about it, it actually makes sense. What is the primary way for these droplets to get out of us? It's by coughing or sneezing or something like that, which is by definition a symptom.
He says, as with every study, there's always room for nuances.
We have to really take it a step at a time and say, what do we know for sure and what is still conjecture? And there's a heck of a lot that's still conjecture out there.
As the state starts to loosen restrictions, Dr. Jameson says this new research isn't an excuse for a free-for-all.
I think it's the right thing to do to open up. I think we have to do it because there were definite economic consequences. There were definite mental health consequences. We had to start opening up. But I would urge people not to let their guard down. I would say do things and control situations the way you can.
So what can you control?
Protect yourself in the best ways you can. Do not put yourself in situations that you're out of control. Mask, wash your hands, and then we're all going to kind of do this together.
Dr. Jameson says outdoor activities have proven to be very low risk for spreading the virus. So wearing a mask outside isn't necessary, but he still encourages wearing them in public indoor spaces.
Everyone chips in, everyone wear masks, you all use good hand hygiene. That actually will be majorly effective to help keep our community safe.
As we keep getting new data, Dr. Jameson says people need to take an objective look at what the study actually says and then make the decisions they feel is best for them and their family.
The evidence has changed so much over the last 3 months, and this is such a new virus that we're finding out more and more.
Keep learning new stuff every day, guys. Dr. Jameson says we have to be really careful about lumping pre-symptomatic people and asymptomatic people in together. Pre-symptomatic means you may not be showing symptoms, but you do test positive for COVID-19, and then you have symptoms a couple days later. So he said that could possibly add to the murkiness of this WHO study. Overall, he says we aren't seeing cases here in West Michigan where people have no idea where they got the virus once they test positive. So he calls that good news because it's easier to contact trace. He says overall, just keep in mind you need to wear your face mask, and as always, wash your hands. Back to you guys in studio.